So today's topic is diet therapy. Those who have the textbook, it's on page number 206 in your dietetics textbook, page number 206, chapter 11. If anyone is joining late, please help them out with the page numbers or topic name. So we'll start with today's session. Diet therapy. So it is usually concerned with diet therapy, okay? Concerned with modification of normal diet to meet the requirements of a sick individual. Usually, if a person is undergoing some health conditions, health issues, okay, they still would require a balanced diet, but with slight modification, okay, in terms of what additional requirements the patient or the person has, okay, that should be fulfilled. And if any therapy they are undergoing, the diet can align with the therapy or treatment, whatever they're undergoing. Okay. So these are the main motto. This is the main motto of diet therapy. It is not a remedy. Okay. This is not a cure. It's not a remedy. It's just certain modifications that you do with a normal diet to meet the requirements of a treatment or a sick individual. Okay. Makes medical or surgical treatments more effective. When diet therapy is followed, if along with that there is an ongoing medical treatment or the patient is on his way or on her way towards a surgery or has completed a surgery and is in recovery phase, okay, diet therapy will help the surgery or the medications to be more effective. That is the only purpose of diet therapy. So what are the purposes? Nutritional status should be maintained. Whoever is a sick individual, their nutritional status should be maintained. Energy requirements should be met even if the person is diseased or they are having some sickness. Okay, they may be on bed rest, but still there is a basal metabolic rate that is ongoing. Okay, and for that energy requirements has to be met. So to meet the energy requirements of the patient who are undergoing a disease condition, diet therapy is followed. To correct any deficiency, okay, that could these deficiencies could be an obstacle towards surgical recovery or medical treatments as well. So to correct deficiencies, to afford proper rest, okay, we usually aim in diet therapy that whatever food you are prescribing to the patients, it is not causing more inflammation in the body or it is not causing the GI system to be overworked. Okay. If the GI system can handle the nutrition easily and it is not causing any inflammation, automatically the patient will be well rested. Okay. Metabolic ability should be stabilized. Changes in body weight, okay, usually weight loss menu, weight gain menu, okay, they all come under different sections of diet therapy. So coming to glycemic index, okay, there are two terminologies that you have to understand: glycemic index and glycemic load. Okay, what is glycemic index? It is simply a ranking system. Okay, glycemic index is simply a ranking system. Okay, you are putting a rank to various food. Okay, you are putting a rank to a various food on the basis of how quickly or how slowly is this food going to increase your blood glucose level. Okay, the quicker it is causing the increase in your blood glucose level, you call it a high glycemic index food. Okay, you eat a little bit of it and immediately within 15 minutes your blood glucose levels is has shot up. Okay, within few minutes, okay, your blood glucose levels have shot up. That is high glycemic index food. Okay, medium R, it will take a little bit time. Okay, 20 minutes to half an hour for your blood glucose level to reach the peak. Low glycemic index food will not cause much difference in your blood glucose level. It is very steady, very slowly your blood glucose levels will increase. Okay, and it is easy on the body as well. Okay, so How was glycemic index calculated? Okay, there is a formula. You don't have to do this practical formula, you just have to understand the formula. Okay, how did this uh, formula come into existence? Okay, so you will take 50 gram of food and 50 gram of a reference food. Usually the reference food is either sugar or white bread. Okay, either sugar or white bread. These are the, or glucose. Sometimes in some laboratories they use glucose as well. Depends on what is your reference food. But the reference food should not change. Okay, if a laboratory is choosing sugar as a reference food, for every other test food, whatever they want to do their analysis on, sugar has to be the reference food. Okay, so the denominator has to remain the same. Denominator has to remain the same. Denominator could be 50 gram of either sugar, 50 gram of either glucose, 50 gram of either white bread. Okay, so the denominator will remain the same. Numerator will be the test food. Okay, whatever food you want to test, you want to check the glycemic index of moong dal, you want to check the glycemic index of normal tur dal. Okay, you want to check the glycemic index of cucumber or carrot, apple, banana, fruits, all the food items that come in the 5 food groups. Okay, any food items you can, you want to check the glycemic index, you can do the test food. But can you do the glycemic index on fats? Can you do the glycemic index on fat? Can you do glycemic index on fat? See your numerator here. Incremental blood glucose area of 50 gram of carbohydrate test food. Whatever test food you are taken, it should have carbohydrate, because carbohydrate can give a glucose spike. Okay, fats or lipids do not cause will not increase your blood glucose level. Protein will not increase your blood glucose level. Only carbohydrate based food can increase your blood glucose level. Okay, so this test, glycemic test, is only for the food items that have carbohydrates. Okay, so only on those food items you can do any food item. If it has carbohydrate, you can do the glycemic index. Okay, multiplied by 100. Okay, so what is that? What is this incremental blood glucose area? Okay, if you give a person, you take a person on empty stomach, you give this person 50 gram of sugar. Okay, mix it with water, lime water or something, and 50 gram of sugar. It's a high calorie drink. Okay, and you give the person on empty stomach. Okay, every half an hour, check their blood glucose level. Every half an hour. Okay, or you will see that when you have this 50 grams of sugar on empty stomach, will it be high glycemic index, medium, or low? What do you think? On empty stomach, you're having lime water with 50 gram of sugar. Immediately, it will be absorbed by the intestine and the stomach. Your blood glucose level will be high. Within half an hour, you will reach the peak, the highest peak, and immediately it will fall down. Okay. After 1.5 hours, if you do the blood test, the blood glucose level will fall down. But there was an immediate hike. Okay. Even if you have watermelon juice on empty stomach, it will still give you high glycemic index, because watermelon has a high glycemic index. Okay. So we'll see that later. Okay. Now, what you have done with, now you have an incremental, this entire red area that you see. Okay. The average of this entire red area is what you put in the denominator. Okay. Because you have given the test for reference food is sugar. Now, on an empty stomach, you have given a person 50 gram of dal to eat. Let's say dal is a test food. Only 50 gram of tur dal was given for the for this person to eat. Okay. um, the person had that, and then you will check how is the glycemic index. Every half an hour you will check the blood test. You will do the blood test. Okay. You will dal has a medium glycemic index. Okay. So usually medium to low is where dals and the lentils and the pulses, legumes, they come. Legumes will have even more low glycemic index. Okay. So that's how you plot the graph, and you multiply it with 100. So you will get a number. Okay. You will get a number. When you do this entire calculation, you will get a number, and that number will decide, is it a high glycemic index, medium glycemic index, or a low glycemic index food? Okay. Whatever is the end result here you get after you calculate all these things, whatever is the end result, that's what is the glycemic index. Okay. You don't have to do this calculation because pre-calculated values are always present. Okay. Just find the glycemic index of any food. If you Google glycemic index of watermelon, glycemic index of muskmelon, glycemic index of a medium sized apple. Okay. Whatever food you want to check, you can just Google online. You will get the answer of glycemic index. Okay. You will have a number given to you. But then looking at that number, how will you tell, is it a high glycemic, medium, or a low glycemic food? Okay. So any food that comes, if you get an answer, if you get an answer that is between 65 to 75. Okay. If you get an answer that is between 65 to 75, it means it's a high glycemic index food. Okay. For example, sugar, white sugar. Okay. Refined cereals, white rice, banana, ripe banana, root vegetables, white bread. Okay. These are high glycemic index food. And if you get a value that is between 45 to 55, okay, though this is a medium glycemic index food. Fruits, unrefined cereals, okay, they all come under this area. And if the answer is between 30 to 40, it means it's a low glycemic index food. Legumes, nuts, etc. So you can use some tricks as well to reduce the glycemic index of the food. Okay. For example, when you are eating rice, you make it into a khichdi, or you have rice with a little bit of rice with lots of legumes. Automatically, the glycemic index, you will have a better control over the blood sugar. Okay. When you're making rotis, okay, when you make the dough of the to make roti, if you mix the wheat flour with Bengal gram, roasted Bengal gram, automatically the glycemic index of these rotis will be low. Okay. So these tricks you can use. You can add psyllium husk, isabgol into your atta. Okay. You can reduce the glycemic index. Add fenugreek powder into the atta. Okay. Before making it to kneading into a dough. Okay. This can also make sure. Highest is 75 glycemic index. It can go more than that as well. So coming to the factors that affect the glycemic index or glycemic response, how does your body respond to glycemic index? What are the factors that affect glycemic index? Okay. One is rate of ingestion, means if I give you apple juice and I give you whole apple, which do you think will cause immediate blood sugar spike? Definitely it's the juice. Okay. Because the sugars in the juice will be very rapidly absorbed, and there is no fiber at all in juice. Okay. You have filtered out the fiber. So usually it's a major source of fructose. Apple juice is a major source of fructose. Okay. But when you eat apple, you take time to chew on it. You take time to swallow it. Okay. And the body will take time to process the fiber and get into the, when you eat apple along with its peel. Okay. body will take time to process the fiber and get into the fructose atoms. Okay, so it will take much more time for your blood glucose level to come up when you eat whole apple as compared to juice. So that is rate of ingestion. How quickly are you swallowing the food? Juice you will immediately swallow. You can gulp it down within a minute, but it will take you 5 minutes or 10 minutes to complete a whole medium sized apple. Okay. Then food components like uh, the more protein and fat is present in the meal, very slower will be the blood glucose level, spike in the blood glucose level, because to process protein, to process fat, okay, it takes time. Okay. So watermelon, it still has 75, almost approximately 75 is the glycemic index of watermelon. Ice cream has a less glycemic index. Okay, ice cream has less glycemic index. Ice cream has a glycemic index around 60 or something. Okay, but watermelon has a glycemic index around 75. Okay, which do you think is healthy? A bowl of ice cream or a bowl of watermelon based on glycemic index? Glycemic index will tell you watermelon is unhealthy because it has high glycemic index, and ice cream is healthier because it has low glycemic index. But remember, we are only considering carbohydrates here. Ice cream is a rich source of fat. Okay, ice cream is a rich source of fat, and we are not considering that fat component in the in this meal. Okay, ice cream, we know that ice cream by practice, we know logically, we know ice cream is unhealthy as compared to watermelon. Okay, but we are only considering carbohydrates here. The carbohydrates present in ice cream is too low as compared to the carbohydrates present in watermelon. Okay, but we are not considering fiber, we are not considering fat, we are not considering protein. Okay, so the food components can also alter the glycemic index. Presence of protein and fat, okay, that will lower the glycemic index. So that's the reason why pulses are recommended in diabetic diet, which have pulses, and legumes have low glycemic index, and they are good source of protein as well. Okay, complex carbohydrates, that like fiber, okay, unrefined cereals, they will take time. Complex carbohydrates take time to be digested, to be broken down. It is complex in structure. Okay, it has big carbon chains. It is complex in structure. Your body will require a lot of time to break it down. So the more time your body requires to is taking to digest it, slower will be the blood glucose spike. The methods of cooking and processing: highly processed food, high glycemic index. Okay, low processed food, low glycemic index. Okay, steamed food, any food that is steamed or boiled, naturally will have low glycemic index as compared to any food that is highly processed, like baked items, pastries, cakes. Okay, high level of processing is used here. Ripened food has more glycemic index as compared to unripe. Unripe banana will have low glycemic index. Ripe banana will have high glycemic index. Okay, so that food processing has taken place. More is the processing, more is the ripening, higher will be the glycemic index. Then you have physiological effects as well, like acidity. Okay, um, when you increase the acidity in your meal, when you have something citrus food, when you have a citrus salad as a first thing in your meal, and then you eat your carbohydrates, okay, it can lower your glycemic index. Having a glass of water with a tablespoon of apple cider vinegar or normal vinegar, you have to make sure it has acetic acid. Okay, so when you have this on empty stomach and then you eat your meal, it can lower your glycemic index because the acidity in the stomach acidity in the stomach lowers the glycemic index. Okay. Drinking lime juice will not help much. Drinking lime juice or lemon water before lemon squeezed in hot water will not help much because that is citric acid. Okay. This study has been done on acetic acid, and acetic acid is found in vinegar, apple cider vinegar, rice vinegar, or any form of vinegar that is available. Just check for the acetic acid content. If the vinegar has acetic acid, it can lower the blood glucose level of the meal that is yet to come. Okay. Lime juice has citric acid. Lemons have citric acid. Citric acid will have a little bit of effect, but not as good as acetic acid. Okay. So these are the food with examples. Low glycemic index food, good for diabetic patients. Most fruits, vegetables, except potatoes and watermelon. Grainy bread, that is multigrain bread, brown rice, fish, egg. Medium glycemic index food, whole wheat products, basmati rice, sweet potato, white rice. Then high glycemic index food, any baked potatoes, white bread, straight up. If you take glucose, glucose has a glycemic index of 100. Okay. So far, is it clear about glycemic index? Next is glycemic load. There is a table 11.1 on page number 209, those who have the textbook. Commonly used food in an Indian household and what is their glycemic index. They have mentioned on this table. Okay. You can refer that for your knowledge later. Next, we will see glycemic load. So as I mentioned, when I talk about glycemic index, it's a ranking system. Rank will not change. Okay. Because do you remember how much was the gram of carbohydrates we were checking in glycemic index? Do you remember what was the gram? How much was the gram mentioned in the formula? 50 gram, right? So whatever food they have tested for glycemic index, it was only 50 gram. It was only 50 gram. Okay. But do you think you will only have 50 gram of carbohydrates in your breakfast, lunch, and dinner, whatever food source you take? Do you think you will limit yourself only till 50 gram, everyone in this world? No, right? So that's why that's a deficient that's a disadvantage of glycemic index. Okay. We checked glycemic index. It gave us good data. It gave us insight about which food can be preferred by diabetics, which cannot be. Which food is good for weight loss, which food is not. Which food is good for insulin resistance, which is not. We have that data because of the ranking system of glycemic index. Since it is just a ranking system, okay, we are checking each and every food on the basis of 50 gram, not more than that. But when you have a meal, you are having 30 grams of maybe 30 grams of some salad, okay, 100 to 150 grams of rice, okay, 200 grams of some legumes, pulses, okay. So whatever the entire plate that is in front of you, the entire meal that is in front of you, that has different proportions of carbohydrates, rice, dal, whatever vegetable curry you are using, whatever protein source you are using, okay, whatever post food drink or dessert you are eating, they all have carbohydrates and it is not limited to 50 gram. So glycemic load, what does glycemic load give you? It will give you an aggregate of the carbohydrates in grams present in your meal, okay, multiplied by glycemic index of each of that food content divided by 100. So after eating this entire meal, or after having this much gram of this particular food, okay, 100 gram of basmati rice or whatever gram of food that you had, okay, how much per 100 gram of this rice, how much will be the glycemic load, how it will cause change in your blood glucose level. That answer you will find from glycemic load. Okay, that is the main use of glycemic load. Glycemic index completely ignores how much food a person eats. Okay, every person eats different quantity of food, even within a family. Okay, every person is eating different quantity of food. So in glycemic index, you are using in glycemic load, you use the data from glycemic index, the rank whatever glycemic index has given, you will use that rank, okay, multiply by carbohydrates in gram in each of the food items that you have eaten, okay, divided by 100. This is the formula. Glycemic index multiplied by carbohydrates in gram divided by 100. That is glycemic load. In textbook, a slightly different formula is given that will also give you the same answer. Glycemic index will be the numerator. Carbohydrate in grams will be the denominator multiplied by 100. So glycemic load, when you do the glycemic load calculation, that will give you the answer of the total glycemic effect of your diet. You ate lunch, you ate these many food, these many different types of food in your lunch. Okay, is it going to be a high glycemic load lunch or a low glycemic load lunch? The entire load of carbohydrates that you had in your entire meal, how is it going to affect your blood glucose level? That is the answer you will get. Okay. It is because of the change in cross multiplication. When you do some cross multiplication, or when you put glycemic index formula here, you will get more or less a similar kind of a formula. Okay. For exams, just focus on what is given in the textbook. So glycemic index also has a scale. Sorry, glycemic load also has a scale. Any food that has scored more than 20 or equal to or more than 20 is a high glycemic load food. Any food that has scored between 11 to 19 is medium glycemic load food. And if any food that has lower or equal to 10, that score is lower or equal to 10, it is a low glycemic load food. So glycemic load, it will help you to keep your appetite in check. What are things you're eating throughout the day? To keep a note of that. Keep your appetite in check. That is what glycemic load will help you with. So the difference between glycemic index and glycemic load. Glycemic index is a ranking system. It ranks carbohydrates based on the immediate response that they show in your blood glucose. Okay. How quickly this food, carbohydrates present in this food, is increasing your blood glucose level. That is what glycemic index will give you. Okay. The quality of carbohydrates present in the food. That is what glycemic index can show you. But glycemic load can help you predict the blood glucose because we are already using glycemic index in this formula. So you can predict the blood glucose response, but along with that, how much of food that you ate, okay, quality and quantity, the volume of food, the quantity of food in how many grams, okay, how much was the food that you ate, that is also connected here. Okay, so glycemic load is a much better calculation option. It gives you quality of the glucose spike, and it also gives you the quantity. Okay. It calculates the amount of carbohydrates that you eat. That is the major difference between glycemic index and glycemic load. Is it clear to all so far? Coming to dietary supplements. So dietary supplements are a group of products that are intended to add supplementation in your diet. Your diet may be lacking in these supplements. Okay. The staple food that you eat is already lacking in these areas, in these minerals, vitamins. Okay. So dietary supplements will aid you to eat your food, but along with that, make your diet or make your intake a much healthier version. Okay. That is what dietary supplements help you with. So dietary supplements are not supposed to substitute your food, okay, or your it is not supposed to substitute your diet. It can come in various form as well, like you have herbal supplements like spirulina, okay, ashwagandha. These all things comes under herbal supplements. Then you have body building products, protein powders, collagen powders, okay. They all come under bodybuilding products. Laxative supplements, those who suffer from, like if you take isabgol or any pharmaceutical laxative to help to aid you with your constipation issues, that also comes under. Isabgol also has a laxative work, so it's a soluble dietary fiber. Then you have biologic and nutrient supplements, your multivitamins, multimineral tablets, nail hair health tablets, omega-3 fish oil tablets, vitamin C tablets. Okay, they all come under biologic and nutrient supplements. So how is it more useful, dietary supplements? Because dietary supplements come in a synthetic form. 1 teaspoon of isabgol on a daily basis is fine. Okay, if you have low fiber diet, if you are not eating salads or fresh fruits on a daily basis, 1 to 2 teaspoon of isabgol on a daily basis is fine. Only if you're not eating fiber. So dietary supplements, whatever form they come in, they usually come in a pre-digested form. Okay. So it is easier for your stomach or intestine to absorb it. Partially it has been digested, like hydrolyzed. If you see on any of the supplements, it's written hydrolyzed, means as soon as it goes into the stomach does not have much work to do. Okay, because it is hydrolyzed. The hydrogen atoms have been broken up. Okay, so directly it will go into the intestine and directly it will be absorbed from the intestine. Not much work is to be done. Okay, so it is easily absorbable. And usually it is used by people who are not taking enough food or have nutrient deficiency, or if they are on low calorie diet. Okay, if anyone whose calorie intake is less than 1500 kilocalories per day, they definitely will require the help of vitamin supplements or mineral supplements. Pregnant women, lactating women, they definitely will have to take folate tablets, iron tablets. Newborn babies will be given vitamin K injection as soon as they are born. At birth itself, vitamin K injection is given. That is also a supplement. Those who are addicted to alcohol, suffering from alcoholism, vitamin B complex is given. People who are recovering from surgery, burns, injury, vitamin C tablets, collagen supplements are given. Okay. Vegans will require calcium, vitamin B12, and vitamin D supplements. People who are taking medications that interfere with body's function, like chemotherapy drugs. Chemotherapy drugs alter your digestive system. Okay, it gives you a lot of nausea, vomiting, indigestion. Okay, so the food that you eat is not absorbed properly. So chemotherapy patients will have to rely on supplements. Those who have lactose intolerance and they can't have dairy products, they will have to take calcium supplements. Drug abusers, habitual dieters, those who are always on dieting or some of the other fat diets they end up with the risk of a lot of deficiencies. Old people, senior citizens, okay, they will have to take a lot of dietary supplements because with age, your absorption capacity of your intestine decreases. People who suffer from chronic illnesses like AIDS, tuberculosis, they will require protein supplement. So that's about dietary supplements. Types are herbal. We have discussed that. Bodybuilding products, laxative supplements, biological and nutrition supplements. Examples are given on page number 240, 211, 211. And there is a table 11.2, dietary supplements and proven claims. Proven claims means it is evidence based. Okay. So what are the different dietary supplement and what it actually does in your body, which has with proof, evidence-based researches has been done, okay, which with proven claims that function, and what is the dietary supplements is given on table 11.2. You can refer that later for your knowledge. Next, coming to diet and inflammation. There is always a link between stress and any diseases that changes your immune system and causes inflammation. Okay, inflammation is like your own body cells are in an aggravated state and it is causing damage to your tissues, healthy tissues, and that is inflammation. Okay, and usually chronic inflammation is associated with poor lifestyle choices like sedentary lifestyle, increased cortisol levels, okay, obesity, inactivity. Okay, these all will lead to low grade systemic inflammation because there is a lot of free radicals in a person who is obese or inactive. Okay, and these free radicals will damage your own tissues, damage your healthy tissues. So people who are obese or inactive or have a sedentary lifestyle, they are at a higher risk of developing a long term disease. Okay, they are at higher risk of developing any chronic means long term diseases like carditis, okay, myocardial infarction, atherosclerosis, kidney disorders, nephritis, kidney failure. Okay, obesity creates a low grade systemic inflammatory response. And first, it starts as insulin resistance, then it turns into diabetes. And when it turns into diabetes, high blood glucose level, when the blood glucose level stays high, it is not coming down. These excess glucose in the blood will trigger inflammation. It will cause inflammation in the body. It can start an inflammation anywhere in the body. Okay, so that's how obesity is related to inflammation. Usually, the diseases quite commonly associated with obesity is people who are obese usually end up having cardiovascular diseases, arthritis, Alzheimer's, immune dysfunction, diabetes, any tumor, necrosis, cancers, colon cancers. Okay. So when we talk about inflammation that is caused by stress, obesity, poor lifestyle choices, there should be anti-inflammatory food that is available. Okay. And we have an anti-inflammatory diet as well. Usually there has been a link associated with inflammation and an early occurrence of Alzheimer's, Parkinson's disease as well. So consumption of diet that is rich in antioxidant or anti-inflammatory agents can lower the risk of developing these diseases. If anyone in your family had suffered from Alzheimer's or Parkinson's, if you start eating anti-inflammatory food or you incorporate anti-inflammatory diet, okay, antioxidant rich diet, your chance of developing these diseases will come down. Okay. So that same pyramid is given in your textbook as well. So an anti-inflammatory diet has the following characteristics. It has variety. Okay. You can call it as a rainbow food. It has variety. And from where do you get the rainbow colors? It's from fruits and vegetables, fresh fruits and vegetables. Those are colorful. Okay, they add more color and variety in your food. Okay, it's with fruits and vegetables and greens that you can add more variety in your food. More the variety, more colorful the plate will look. Okay, so you can be sure that it has a lot of antioxidants. And anti-inflammatory food are low processed. They are not processed much. They are not refined. And they are packed with fruits, vegetables. They have good calories, balanced calories that promote optimum weight gain. Complex carbohydrates, high in fiber. They have low glycemic index and moderately low in animal proteins, like except for fish. Fish you can have. Fish is a good source of anti-inflammatory food because food has omega-3 fatty acid, and omega-3 fatty acid is anti-inflammatory in nature. Okay. If you suffer from issues like acne, frequent acne is okay, you have start having flaxseed oil tablets or start having omega-3 fish tablets, even just one tablet a day. Continue that without stopping for the next 3 to 4 months. You will see how the skin clears up because it's anti-inflammatory in nature. Okay, even if you are having some acne, within few days it will clear up because the fish oil will not allow the inflammation to prolong. Okay. More of plant proteins like legumes, soy based food, nuts, extra virgin olive oil, avocados, anything that is rich in omega-3 fatty acid, fish, walnut, flax seeds, garlic, lots of green herbs, turmeric, ginger, frequent tea consumption, but green tea without sugar. Okay. Or you can, the best thing better than green tea is black coffee. Okay. Black coffee without sugar. That has been studied extensively, more than green tea or black tea. Black coffee has been studied extensively, and it has proven antioxidant qualities. Okay. But without sugar or milk. Consumption of red wine or any alcohol nowadays, it will not be allowed, or usually we are going towards a phase where consumption of red wine will be taken back. This advice will be taken back. Only if alcohol is consumed, only if a person wants to have some alcohol in their day-to-day life, which is not recommended at all, red wine is the only best option that we can give. Okay, but generally no alcohol consumption is the best advice. No alcohol consumption is the best advice. Black coffee consumption on a daily basis, it is good. You can also get black coffee decaffeinated, which has very low caffeine in it, so that will not cause any issues with the hypertension patients. Okay. Dark chocolate without sugar is also a good treat. So the pyramid which I have shown here, the same one is available in your textbook as well. You can refer that later. Prebiotics and probiotics. This is that is the microbiome of your gut, the gut microbiome. Okay. So a lot of chronic diseases and inflammatory diseases, you can treat it if you just focus on your gut microbiome. The good bacteria that is available in your good bacterial flora that lives in your intestine, that helps you digest the food. Okay. The byproducts that these bacteria produces, it's good for your body. Okay. The antioxidants these bacteria can produce, it is much better for your body. So that is the importance of prebiotics, probiotics, and symbiotics. Okay. So prebiotics, what are prebiotics? Directly you are giving food for the bacteria. Whatever you are eating, you know that this will go and help your gut bacteria. Okay. Prebiotics are food substances that can, you already have gut by bacteria, you want to enhance their number, you want to enhance the quality of life that they have. Okay. Not harming them, but giving food to them, that is prebiotics. Okay. So prebiotic food will not be easily digested by your body. It is resistant, like unripe bananas, resistant starches, okay, fiber, anything that is any insoluble fiber, not soluble, insoluble fiber, which cannot be digested properly from by your intestine. Okay, this can go to your this your microbiome in the intestine will have a party on it, which cannot be digested by your intestine, because they will undergo fermentation. This resistant food will undergo fermentation, and this fermentation will help the gut microbiome to thrive. Like inulin, lactulose, these are fibers, these are different types of fibers that are considered as prebiotics. Galacto oligosaccharides. So food that is rich in prebiotics: radish, garlic, ginger, apples, broccoli, unripe bananas, okay, barley, whole wheat, oatmeal, onions, leek, okay, legumes with with their that cover with the, not the legumes in which you take away the fibrous part. All good berries, all the types of berries, honey as well. Okay, these are good prebiotics, good for your, these are the food for your microbiome, gut microbiome. Then you have probiotics. Probiotics are live bacteria, live bacterial cultures that you eat. For example, curd, yogurt, buttermilk. When you have any fermented pickles, okay, vegetables that are fermented, kimchis, okay, these all are even cheese, okay, these all are probiotics. Probiotics are live bacteria that you introduce in your food, like lactobacilli. Lactobacilli is a kind of like bacteria. You find it on chilies as well. Okay, even green chilies have lactobacilli. Apples, the inside of the apple, just remove the seed, where you see the seed part. Remove the seed and have that entire area. Don't lead to any food waste. Okay, have the entire apple except for the seed. Remove the seed, and except for the seed, wherever the seed is sitting, eat that part as well. It is rich in live bacteria that is healthy for your gut. Okay, it's a good probiotic. So you can there is these probiotics can also inverse your risk of colon cancer as well. It can reduce the risk of colon cancer, reverse your insulin resistance. Lactobacilli and bifidobacteria are the most common bacteria which we use in probiotics. And if you want to directly have a probiotic drink, you can have that Yakult. Okay, Yakult milk that is available, fermented milk. Okay, when you're having Yakult, have it only for 25 days, 5 days or a week. You have to rest. You don't have to take Yakult at all. Okay, because you have to allow the bacteria to thrive. Okay, that period you have to give for your gut bacteria to thrive on its own. Okay. So if you're having Yakult, don't have it directly for continuously without stopping. Don't have it. Take a break in between. If you are prescribed with lactobacillus tablet, your doctor will tell you how long you have to take. Okay. Usually people who have indigestion, those who have undergone diarrhea, you are suffering from diarrhea for various days together, indigestion, steatorrhea, IBS, okay. People who had suffering from these acute cases of these conditions, you will be prescribed by lactobacillus tablets. The gastroenterologist will prescribe you these tablets. How long they have prescribed you, you have to take it. And before food, after food, however they have prescribed it, you have to take it. Okay. People who are lactose intolerant, you can take probiotics which are present in curd, yogurt, buttermilk, because it does not have lactose. Okay. Milk has lactose. When the lactose undergoes fermentation caused by lactobacilli, okay, when it undergoes fermentation, the lactose becomes lactic acid. So they no longer stay lactose. All the lactose have been converted into lactic acid. Okay. So curd does not have lactose. Curd has lactic acid in place. If 30 days a month, 30 days a month, if you're taking Yakult, 5 days you have to take a break. Okay. Yakult is a good option to introduce probiotics in your food. So these are the examples of prebiotics and probiotics. Prebiotics, food that are for your gut microbiome, as per asparagus is shatavari. Okay, not that much used in India. Wheat bran, when you sieve the atta, okay, when you do sieve the atta for kneading, what remains back in the sieve is wheat bran. Okay, don't throw it away. Use it in the atta. Okay. Search for stones, throw away the stones, and whatever bran is remaining, put it back into the atta and knead the dough and have it. It's wheat bran is good for the gut microbiome. Garlic, onion, banana, okay, radish. Then probiotics, live bacteria, yogurt, curd, sour cream, kefir, probiotic milk like Yakult. Coming to artificial sweeteners, aspartame is banned because aspartame is associated with a lot of cancer risk. So aspartame is banned at many places. Okay, apart from that, you have low caloric sweeteners like polyols, sugar alcohol. They are natural, but they can be synthesized on an industrial scale as well for selling purpose. Mannitol, maltitol, isomalt, lactitol, okay, anything that has OL at the end, that's a polyol, sugar alcohol. They don't have much calorie. Synbiotic is both prebiotic, a food that is prebiotic as well as probiotic. Okay, for example, fermented vegetables, kimchi. Kimchi, fermented vegetable, is a good example of synbiotic. It acts as a food for your gut microbiome. It also has gut microbiome. Okay, that is synbiotic. So polyols, they are less sweet and they give only 50% of the energy, not as high as sugars. 1 minute. So polyols, 50% of the energy you will get, but not as high as sugars. Okay. And it is easily available to human body. The average caloric value is just 2.4. Okay. But even if you are on a weight management or diet management, you can skip polyols. You can go for stevia, which is much natural kind of a sweetener. Aspartame is banned. There is a new risk of aspartame found with a lot of cancer patients. Acylsulfame is can still be used. We do not have much evidence-based research on acylsulfame. Okay, that is non-caloric, which means 0 calories. Polyols still have 50% calories of sugar. Okay, but aspartame, acylfame, they don't have any calories. They are completely 0 calories artificial sweeteners. And the natural known caloric one is stevia. Stevia, based on stevia, questions can be asked in the exam. Okay, so 50 gram of stevia powder can give you the sweetness of 1 kg of cane sugar. Okay, and it is because of the element that is found in stevia, which is called stevioside. Okay, so questions related to this can come in the exam, so mark that topic as important. Okay, artificial sweeteners topic as important, especially stevia, polyols, and non-caloric sweeteners. Like skip aspartame, because aspartame now it is banned. Saccharin, sucralose, stevia, you can study on this. Food and nutrition and drug interaction. So this is only for the doctors here. Okay, people who are not from a medical background, you don't have to read this. But whoever is from a medical background, you can go through this topic of food and drug interaction. How food will, if you are on certain drugs, medications. Okay, how your nutrition will affect its affect the medication's effectivity. Okay, and how medication can affect your nutrition. For example, as I mentioned earlier, chemotherapy drugs. Chemotherapy drugs will cause serious side effects like nausea, vomiting, indigestion, diarrhea. Okay, and the chemotherapy drugs will majorly target your gut, your intestinal health as well. So definitely the nutrition will be affected in a negative way. Okay, so that is one of a food and nutrition, food nutrition and drug interaction, an example of it. Okay, so doctors who are dealing with the prescription of various drugs, page number 223 onwards, a lot of tables have been mentioned. Okay, effects of food on absorption of drug, effects of various food and beverages on drug interaction, examples of drug nutrient interactions. Okay, these tables are given for practicing doctors. You can refer these tables. You can do your self study on this, because these are prescription based drugs. How it affects the nutrition, this you have to study. You can directly practically apply it. Questions related to this part of the chapter will not come in the exam. Okay, this is only for the medical practitioners for their knowledge. Okay. So drug nutrient interaction, there are two types of interaction. Drug nutrient interaction, which means result because of the mechanism of action of a drug, a nutrient will not be absorbed properly, or a nutrient will be absorbed in a more than required amount. Okay, which will negatively impact the patient's health. Food drug interaction, different types of food that you have. Okay, if you are having a lot of fibrous food, that will affect the absorption of drug. Okay, high fibrous food will increase your peristalsis movement, and it will not allow the proper absorption of drugs. So that is how a food can affect your drug interaction. Having high iron rich food, okay, will not allow the proper absorption of calcium supplements. Okay, so that is a food and drug interaction. So all the doctors here who are practicing allopathy, okay, you can go through tables. These are the tables. Others don't have to go through this chapter, this part of the chapter. Don't go through this. Personalized nutrition, nutrigenetics, and nutrigenomics. This we will deal in detail. There is an entire chapter called nutrigenomics. Okay, nutrigenetics is how your genes affect how your body responds to food. Nutrigenomics is what you eat, how it affects your gene. For example, uh, there are North Indians and South Indians. Okay, classic example. South Indians will not tolerate milk products more as compared to North Indians. North Indians can tolerate milk based products more, dairy products more. Okay, because of the ancestry, a lot of dairy based businesses flourished in northern India. Okay, a major diet preference was based on ghee, curd, lassi, milk for North Indians. So you already have the gene that can digest lactose for a longer period of time. Okay, but South Indians after the age of 30, 35, majority of the South Indians will become lactose intolerant because you don't your genes that supports lactose digestion stops functioning. Okay, this is how your genes you are born with, how it responds to different food. That is nutrigenetics. But what is nutrigenomics? If North Indians or South Indians doesn't matter, if you have a lot of chemically processed food, okay, over processed food, over saturated fat present food, doesn't matter whatever is your ethnicity, your risk of cardiovascular diseases will increase. Doesn't matter what your genetics are. Your dietary preference will have an effect on your health, will have the effect on your genes. Okay, that is nutrigenomics. Is it clear to all? So if you have any queries, you can mention in the chat box.